Hello everyone. So let me start with the orientation session. I am Dr. Monalisa, your anatomy educator for the Prof Essentials, which is started on the PrepLadder platform. So for those who are knowing me for the first time, let me introduce myself. I am Dr. Monalisa, have done my MD Anatomy from Armed Force Medical College, Pune. I have completed my senior residency from Lady Hardinge Medical College, New Delhi, and currently working as an associate professor in Delhi. So I am your anatomy educator for your all anatomy related doubts and all the topics to be covered in the entire anatomy for the Prof Essentials of the first year. So before just starting about the session, and let me introduce about what all we are going to do in this session, I would like everybody to know why we are doing this. So the students of the first year MBBS, they are very much at times get depressed, and at times the lots of information and the targets to be achieved in less span of time. So if I talk about the first year subjects, we have got anatomy, biochemistry and physiology. So there is too much to study in less span of time, and their internal assessments are not good. They are not understanding the concepts and they are not able to memorize it. Also, when their internal examination comes or the viva or practical examination comes, they are not able to get a better marks, and at times they feel depressed at how we are going to pass the university exam. As we know that the first year subjects are the preclinical subjects, so proper understanding of this subject is very important so that you can correlate it with the clinical understanding. So as I talk about the first year MBBS, the NMC guidelines, three important subjects you have to complete: the anatomy, physiology, and biochemistry with all the conceptual learning. So what is the objective of starting the Prof Essential? If I would like to concentrate on my subject, that is anatomy. So if I talk about anatomy subject, it's very important to understand the organs, the microscopic studies, and also the gross anatomy to correlate the location of bones, the muscle attachment, the nerves, the blood vessels, and the function, and also with the clinical anatomy. So proper understanding is the goal which has to be achieved, and the mission. So I would like to talk about the mission which we want to achieve. So basically we have to focus on conceptual learning, because just memorizing the thing will not help, because we have to write all the university answers, question papers that we have to solve, the short notes, the long questions, the clinical oriented questions, and also the MCQ. So it is not just memorizing it, the facts, which will not help to get a better rank in examination or better marks. So it is very important that we should focus on conceptual understanding of each and every topics. So, and the best way to achieve this is why to know. Okay, always ask the question why. So I am your anatomy educator, and I will be on this platform through YouTube sessions, and we will discuss each and every topic in detail with proper understanding of each and every concepts. So what all things we are going to do and how we are going to make it possible. So I would like to share a few tips so that we can get a better understanding of the subject. So first thing is that when I come with the topics, okay, so I would also like to summarize the important topics of anatomy. So so we are going to start this session from April. So you will be connected with the first year Prof Essential faculties on the YouTube channel, and the sessions will be absolutely free for you, and you should make a habit of attending all the lectures and summarize in your own words. And actually the notes will be also provided with along with the live sessions, and you should summarize the important parts and important topics and concepts which I will help you to understand. Not just memorizing the content, it is very important that you understand why it is happening, orientation of the subject with the correlated. So this will be also integrated with other subject. So to better understand, so that you can write in examination, you have to understand the concept with diagrams and flowchart. So wherever necessary, I will make the flowchart, and you will also make the flowchart along with me. The diagrams will be provided to you, and we will draw the diagram together. Actually, when I talk about anatomy, visual memory is very important to retain the information, so that mapping of the topic is done in your brain for longer duration. Okay, so it's first thing which I want everybody, that you should attend the lectures regularly, and you can also make your companion group where you can discuss the topic, and again you can ask the doubts from me. So there will be a mentorship program also. We will solve all the previous year question papers, not only of one university, but multiple university together. I will make I will just scatter all the university papers of multiple university and important long questions, short notes, and also clinically oriented questions. Also, the important things which you have to know, definitely the most important questions, and also all the relevant clinical concepts will be explained, and we will solve the university paper questions together. So we will go in a very systematic way. We will cover all the topics which is important to get a better marks in your examination, so that you are good in your internal assessment also, and you are very good in the external assessment also. That is, you should get a better marks in the university exam. So whenever the lecture is of anatomy, you should be prepared with your notes, with your HNE pencils for histology, with pencils, color diagrams we will make. We will use, so I will give you a note of all the things which is required prior the classes when it starts. That is very, very important for you. Okay, so that integration of subject along with the vertical and horizontal integration will also be done, and the most important topics will be covered. So there will be a regular session. I will start the session from April. So in the month of April, I would like to start with general anatomy topics. Actually, the schedule of classes will be given to you prior, which will be on the YouTube channel of the PrepLadder. So you should attend it live on that day, and it will be also there. If you are busy with your college, or you are not able to join live, then you can attend the session afterwards also. Okay. So then you have to actually each and every topic university papers will be also short. So you should sit and solve it along with me. Related diagrams will be made, and it is very important that you should have the concepts being clear. Okay, so that we will do it together. Now, I would also like to tell about the major divisions of anatomy. So, gross anatomy, when I talk about gross anatomy, it is what we see after dissection. Okay. So, all of you are aware of cadaveric dissection, which is going in your colleges. So, you should attend that. And gross anatomy is what we see with our eyes. Okay. So, exactly, gross anatomy is very important, because once you understand the important location of the organs, the nerves and the artery, and orientation where it is located, and how we are going to recognize that structures, so that is important. Then after gross anatomy means the macroscopic study, which we can see. No microscope is required. After that, we should also know about the histological aspect. Why it is important? Because once you know the normal histology, that is the microscopic study, then only you will better understand the second year subject, that is the pathology part. Neuroanatomy, a very important topic of anatomy, which is consist of brain, spinal cord, brain stem, cerebellum, tracts, ascending and descending tracts are there, arterial supply. So we have got basal ganglia. So all these topics will be covered. Osteology, where we will study the bone. So all these sessions will be completed on the platform. Embryology, the developmental anatomy, radiological aspect, and the surface anatomy correlated with the living anatomy. So actually, these are the major division of anatomy which will be covered, and all the scheduled timetable of the lectures when it will take on the YouTube session live will be provided to you prior the session. So be prepared for the session. That means be prepared for your either iPad if you want to write on the iPad, or your notebook, and we will draw the diagrams, flow chart, and understand the topics with multiple images which will be taken from the standard books, and many of the images which you will make along with me. Okay, we will interact together. You can ask your doubts right itself when the session is going on, and also I will be connected with you for your doubts afterwards also. Okay, so the entire concept of covering the topics of the first year subject will be the entire topics. Then we will also have a rapid revision session, which will be very helpful for you before the examination. And we will also have a session which will be practical. So which will be very important to crack the practical exam, that is Viva Voice. So if particularly if a topic is done, the university papers will be shot together along with the theory part, along with the most important things which will be asked in the Viva examination will be also correlated. Okay, now the key topics. the key topics, which I will start with the general anatomy topic, and thereafter I will explain the gross anatomy. So we'll go topic wise. Okay, so I will start a series. For example, I will start in the April month. From the 1st April, I am going to start with the general anatomy, because general concepts is very important to understand the gross anatomy, the microscopic, and the developmental anatomy. Then I will go with the limbs, and we will cover the abdomen, pelvis, head and neck, thorax, the neuroanatomy part, in which the brain and spinal cord is the most important topic, the cerebral hemisphere, the functional areas, the cerebellum. So actually many topics are there. So if I am going to write all the individual topics, it will take too long. So don't worry about this. I am there and I will cover the entire topics together. Then we will go also with the important systems, the reproductive system, the digestive system, the respiratory, the cardiovascular system, the microanatomy of the important organs. I will give you the features that is called as histological identification point. So whenever a slide comes for the examination, you have to focus that particular slide for better understanding. If you want to see the epithelium, you have to focus under 40x. So basically the identification points should be under 10x power, and then we will know the most important identifying features, which is important to identify that particular slide. So all the histological slide, which is very important for your university exam, will be covered up. The general embryology, the systemic developmental aspect, along with the models. So all the pictures, images, I will incorporate in my PPT, in my PDF notes, which will help you to understand the topics. Okay, I know the internal assessments are going on. You must be having the summative exam, and you want to get a better marks in this exam. So please don't take tension load, because ultimate goal is to get through this examination with a better marks and also with a better understanding. Because if you are understanding the preclinical subject, then only you can understand the clinical subjects. Okay, so also we know that after a few years, the next is also coming. So we have to prepare this topic in a way so that we are very much prepared for the university papers and also prepared for the next examination. So after each and every topic, the related MCQs will also be solved. So for that, collection of university papers will be done for the first year MBBS students from various universities, and all will be solved along with you and me together. Now, practical learning will be of cadaveric dissection sessions. So their cadaveric images will be there, and I will give the pointers, and I will discuss the spotting topics, and I will help you to understand these topics. Histological identification slides. So many of the histological images and pictures will be gathered, and the most important identifying points will be noted, and we will make the diagram together, because in histology also, after the identification of a histological slide, it is important to make the diagram of it. So in most of the university, what happens, there will be spotters for the identification. There will be discussion of histological slides. So epithelium is a very important topic, which is the most important topic to get through. So first topic of the histology will be the basics and the epithelium. Radiological images, all the PA and AP views will be discussed. Surface anatomy and clinical anatomy. Actually, these are the topics, and also the osteology part will be covered, so that you will get a better marks not only in your theory paper but also in your practical examination. And viva points will be discussed. Now, I also want you to know that for a better, I am there and my notes will be there for you. Also, the university question papers will be solved. So that will help you to make a basis for your examination, and you can get a better marks. Other than that, I also want that these are few books which I have mentioned that is very important. So Gray's Anatomy Student Editions is very important for the images. You can go through through this book for your images for a proper understanding. There is also, for conceptual understanding, there is one more book, that is the Last Anatomy. Like movements of the shoulder joint. This is well explained in the Last Anatomy. BD Chaurasia, all the volumes. Then we will have Clinical Anatomy, Snell's, Langman's for the embryology part, and in the B Singh for the histology and embryology. So basically, these are the reference book. These are the books which the first year MBBS students for anatomy definitely will have. Okay, but we will go in a different way. I will come with a topic. We will cover this entire topic in the first go very systematically. Like actually, I should have included the entire timetable of the April month. So don't worry. I have already told you that we will start with general anatomy, and I will tell you about the date, time, and which topic will be covered. Subsequently, you will be also prepared for this topic, and we will solve all the MCQs and all the university papers together. Okay, so please don't worry, we are there to help you, and we will be like a our association will be through the entire this journey, and you can ask me your doubts right itself when the session is going on. We will also have mentorship programs, and for anatomy, I have told you the most important all the topics. The most important topics will be told during the class. For biochemistry and physiology, educator will tell you about the details. So this is important. Why these sessions are very important for you, because you have to understand everything conceptually. Okay, it's not just that you have to memorize the topics, and that will be not helpful if you want to write in the theory paper. Many students complain me, ma'am, we have understand the concept, but when we come for the university examination, either internal assessment, and when we see the marks which we have gathered in our internal assessment, we become very depressed at why it had happened. So the thing is that revision is required. Okay, so 2-3 times revision is required. So first time we will cover the entire topic. We will have the rapid revision, ultra rapid revision, viva voice, and the practical session will be done and completed separately. So that will be very useful for you. Actually, in anatomy, if you draw a very neat label diagram with different colors, for example, if I talk about the colors being used, we generally use red colors for the arteries, blue color for the veins, brown for the muscles, yellow for the nerves, and we have green for the lymphatics, so ligaments and all. So it's very important that wherever necessary, we have to draw the diagrams. Okay, and it's also not important that you should write. The proper way of attempting a university question paper is to draw a flow chart. Okay, it should be more systematically. The important points should be there, and I know the bulk of information is there in less span of time. If I talk about after completing your medical entrance examination, you have happily joined your medical colleges, and after that what happens, many information comes in less span of time. So at times it becomes very difficult for you to memorize all these in a less span of time. So that can be done with conceptual study, most important topics, and the crux point. Okay, it's not important that each and every line in the book should be memorized, but the crux point, and it will come once you join the session with us. And I am there, and all the other educators are there on the PrepLadder for Prof Essential platform, and we will crack the exam together. So all the best, and thank you so much.